All right, in health news, polycystic ovary syndrome, or PCOS, well, it has a new name. So the change comes after a global consensus among medical experts and patients and 14 years of studies. The Endocrine Society says the name change is huge for the understanding of this condition that impacts 1 in 8 women, or roughly 170 million women worldwide. The World Health Organization says up to 70% of affected women go undiagnosed. I want to bring in Dr. Molly McBride. She is an OB/GYN with her own practice right here in New York City. I really appreciate you being on set with us today.
It's my pleasure. This is a passion for me.
And by the way, for many of the folks in my social media circle, I've seen a lot of people posting about this, about how it's helped them get a proper diagnosis. So let's first, if you can just help us understand the name change and why that is so critical.
The original name, polycystic ovarian syndrome, is so outdated. It really only focused on a pathological diagnosis of multiple follicles, which is not even pathological. They're just antral follicles. It's normal. The biggest thing with polycystic ovarian syndrome having a name change is the basis of this disease is metabolic. And there's been a whole lack of understanding. There's been a lot of Band-Aid treatment and not really getting to the root of the problem. The root of this disease is endocrine and metabolic. So the name change to polyendocrine metabolic syndrome, I hope, helps a lot of people, because it's not just the symptoms. So for a long time, people were just put on birth control to control the symptoms, to have regular periods, fix the acne, fix the hyperandrogenism. But the basis is insulin resistance. So the insulin resistance is what causes the hormone imbalance, which then can lead to diabetes later in life, cardiovascular health, hypertension. So this is not just a physical issue of having acne and irregular periods, sometimes infertility. It's really a metabolic health condition. So I'm hoping that this will help better get this diagnosis in a shorter period. Women have had to see multiple specialists. Nobody really has control over it. So I think focusing on the root cause will help people get better treatment more accurately, faster, with a new name.
So if the condition, and from what I understand, it's fairly common, why did it take so long, if it's so common, for us to get a better understanding of it?
Well, there has not been a lot of research or public policy around women's health.
Oh, on women's health overall.
In
yes.
general. And it's actually a large part of the population, but it often starts in adolescence. So I think they're with a pediatrician, they're not with a gynecologist yet, their primary care doesn't really know, and they couldn't put the pieces together. So they were really treating surface. You know,
Well, what age does it start, doctor? Sorry.
It can start as early as girls get their period.
Wow.
So
But it goes undiagnosed.
it goes undiagnosed because they have irregular periods, but people say, oh, that's just because you're a teen.
Right.
They have acne, they have trouble with weight, they have trouble with excess hair growth, you know. So people were focused on the superficial issues, not getting to the root of the problem. So the birth control pill evened out the hormones and fixed the acne, but it didn't fix the health problems. And that's the biggest thing that has to be diagnosed now, is that this is a problem of insulin resistance. And I think we've now heard a lot about insulin resistance these days and what it does to your health. If you don't fix the insulin resistance, women are going to have long-term health issues with obesity, diabetes, hypertension, and high cholesterol.
And you think about, you know, the kids who are that young. I mean, even as an adult, I feel like I don't have the tools to advocate for myself. You don't know the questions, especially at that age, and what's normal and what's not.
And if you ask Kelly, when you go see your OB/GYN, if you ask about what may be symptoms that present, is it easy for a doctor to say, oh, we should really test you for this, or?
Depends on the OB/GYN.
It should be, but surprisingly it hasn't. This has been around for a long time, and it's really common, 1 in 8. And it's just been really misdiagnosed. It's been my passion to really help And these girls are young. It shakes their confidence. They're told they're not going to be able to have a baby, which is not true. The infertility is fixable if you diagnose the root of the problem. So their confidence is poor. They feel bad about themselves. And I think really what they need is to be validated. This is genetic. It's not their fault. And we can fix it. And you're not going to have infertility. You're going to stay healthy and avoid diabetes and heart disease.
Well, doctor, really appreciate you being on with us. So it sounds like have those conversations with your doctor. Don't be afraid about this. And this new name change hopefully will help things. Thank you so much.
Thanks so much.
Doctor. Appreciate it.